Bismillahirrahmanirrahim. So my topic for today's presentation is ergonomics in laparoscopy. So first of all, if we go towards the meaning of ergonomics, it is derived from two Greek words. One is ergon and another is nomog. Ergon stands for the labor and nomog stands for the natural law. So ergonomics in simple words is a study of people in the working environment. Now, why is this topic very important? This is important because laparoscopic surgeons are required to maintain various positions during performing of surgery. And unfortunately, there are only 11% of laparoscopic surgeons who know about the ergonomics. And that's probably the reason that 89% of the surgeons are suffering from back pain, shoulder pains, and neck pains. And unfortunately, most of the surgeons consider this as a part of job. Unlikely, although it should be considered as a warning to make certain important adjustments and OT modifications. So first of all, if we go to differentiate between an open surgery and a laparoscopic surgery, there are few main differences. In open surgery, we use to touch the tissues directly, and in that we are using all the two or three senses like sense of vision, touch, and position. But in laparoscopic surgery, we are unable to directly touch the tissues, but instead we are able to touch the intra-abdominal structures with the help of long instruments. And that's why performing laparoscopic surgery is comparatively difficult task as compared to the open surgery. Another difference is that in open surgery, we are having large performance reserve. Like we can perform for many hours without getting tired. But in laparoscopic surgery, small tasks can make you easily fatigued if we are unaware of the ergonomics. So as I mentioned, the laparoscopic surgery has certain limitations that make this job difficult for a surgeon when it is compared with the open surgery. Like in laparoscopic surgery, we can see only 2D image. That means a picture which is formed in only X and Y axis. And we cannot appreciate the depth perception in that. And similarly, there is difference in the movements. There are only 4 types of movements which we can perform in laparoscopic surgery, like we can move in and out, do up and down movements, towards right and left, and rotatory movements. And another thing is that in open surgery, we can view whole of the field that is quite wide, and we can see all the surrounding structures at the same time. But during laparoscopic surgery, the view is only limited to the scope tip. So as I mentioned, in laparoscopy, we can do 4 types of motions, and in open surgery, there is 360-degree freedom of movements. That's why the movements in the open surgery are comparatively easy. So just for example, like say for example, we are performing a task like you are sitting in your car to drive it. So first of all, we do our adjustments. We adjust seat according to our legs and feet length. We check our steering. We correct our side mirrors and all the surroundings so that we can perform driving safely and we are not getting tired easily. So the basic concept of understanding ergonomics in laparoscopic surgery is the same. While starting any laparoscopic surgery, our purpose is to perform it safely and so that we are not getting tired easily. So there are certain factors that should be kept in mind while doing laparoscopic surgery. The height of the operating table, position of the monitor, foot pedal location, port placement, certain factors related to the instrumentation, surgeon and team position, and the technical advancements. Now, the operating table height should be roughly at the mid-thigh level, such that the angle at the elbow should be between 90 to 120 degrees. And there can be two types of tables. One table is ortho type of table in which the fulcrum is towards the head region, and another type of table in which the fulcrum is in the center. For laparoscopy, those tables are better whose fulcrum is at the center. And in this picture, you can see that the OT,
थोड़ी सी गर्म करो दाल भी, थोड़ी सी दाल गर्म कर देना, थोड़ी सी.
in this picture, you can see that OT table is comparatively high, and that's why the angle between the arm and forearm is less than 90 degree, and this causes increased strain on the back muscles and the shoulder muscles, which will lead to early fatigability. But in this picture, the OT table is at the thigh level, and the arms and forearms, the angle between the arm and forearm, that is elbow angle, is within the range of 90 to 120 degree. So a surgeon will be relaxed and one can perform for longer times without getting exhausted. Second component is video monitor. The position of the video monitor will affect the neck and the back posture. And it is said that the monitor should be displayed at least 6 to 8 feet from the surgeon. It should be exactly in line with the surgeon and the target organ, and should be 15 to 40 degree below the eye level, so that the downward gaze is achieved. In this picture, you can see that this is the eye vision level, and here is the monitor. So this is approximately 25 degree below the gaze, and that's why this is the most comfortable location of the monitor for a surgeon during laparoscopic surgery. And with the help of this, your neck and back muscles will be straight and in correct position. Similarly, if you can see at the table, so the table is at the mid-thigh level, and that's why the arms are relaxed at L with the elbow angle of 90 to 120 degrees. Another concept in the ergonomics is coaxial alignment. A surgeon, the target organ on which we are operating, and the monitor all should be in same line. Like, say for example, if we are performing laparoscopic cholecystectomy, so the surgeon is lying on the left side, and the target is in the right hypochondrium, and the monitor should be also above the right hypochondrium region, so that all these three things are within the same line. Another thing is that there should be 2 or 3 monitors in which surgeon, assistant, even anesthetist, all can see without changing their position or twisting their necks or body postures. In this picture, we can see that a surgeon is standing in the in between the legs in a split leg position, and the target of the surgery is the stomach in the epigastrium region, and the monitor is lying near the head of the patient. So this single line is called coaxial alignment, which is the basic principle of ergonomics. Now, ports configuration and triangulation are also basic component of ergonomics. So all the ports are placed with the concept of baseball diamond, in which the port placement is compared to the position of the bases in the baseball field. So there can be two types of setting. One can be so so the important concept for performing any procedure during laparoscopy, it is important to achieve triangulation, and it is a relationship between the two instruments and camera in relation to the target. An ideal visualization occur when camera is placed in the middle and above the plane of the triangulation within 40 to 45 degree of visual angle. Like this is the right hand instrument and this one is the left hand instrument. So ideal visualization and triangulation occurs when the ports are in contralateral position and the optical scope or camera is in the middle, and that is above the two ports. So ports can be arranged either in contralateral fashion or in ipsilateral fashion. When ports are placed on either side of the abdomen, say for example, we are performing laparoscopic hysterectomy, in which if right-sided working instrument or trocar is passed in the right iliac fossa and left side working 5 mm port is passed in the left iliac fossa, then this will be contralateral port position. Like in this diagram, you can see this is the right side of the abdomen, this is the left side, and in center there will be optical port. This is the inside view in which right and left instruments are used for triangulation in contralateral fashion. And this picture also shows the same. This is the right hand, this is the left hand, and in center there is optical port or camera port. The benefit of contralateral ports is ideal triangulation, and one can do suturing in early stage of their career quite easily with the contralateral ports. But with passage of time and experience, there are also surgeons, particularly my mentor, Professor Zareen, who is performing suturing with the ipsilateral ports too much easily. If the left and right hand instruments both are used from one side of the abdomen, this ports fashion is called ipsilateral ports. As you can see in this diagram, from here we can see the optical trocar, and on the right side of the box, the right and left hand instruments are used. So this port fashion is called ipsilateral ports. This is the inside view of the ipsilateral ports position. Although this is not there is not ideal triangulation that can be achieved in ipsilateral ports because instruments are parallel to each other. And this is also not ideal visualization because camera is not in between the triangulation. Hence, there will be difficulty in suturing. But as I said, expert surgeons and experienced surgeons can also do quite efficient endo suturing with the help of ipsilateral ports as well. There are also instrument factors that can affect the ergonomics of the laparoscopic surgery. If there are better and high quality cameras used for the laparoscopic surgery, they might compensate for some loss of depth sensation. And if ACE camera gives you 10 to 15 times magnified pictures, so the visualization is quite better. And the ideal monitor distance from the surgeon should be 4 to 8 feet away from the surgeon. Another important consideration during laparoscopic surgery, which is not present in the open surgery, is that if you see at this picture, there are three instruments, and this red spot signifies the abdominal wall. Now, in this condition, if you move your hand up, your tip of the instrument will go down. And if you move your hand down, your instrument tip will go up. So the movements of the tips of laparoscopic instruments are vice versa is to your hand movements. That's why laparoscopic surgery is comparatively difficult. Now, the ergonomics is mainly involving physics. That's why there are many angles which should be taken in consideration before starting or doing laparoscopic surgery. There are three basic important angles. One is manipulation angle, another is azimuth angle, and third one is elevation angle. If you can see in this diagram, this one is the right hand instrument and this one is the left hand instrument. And in center we can see the optical port. So we are using the right and left hand for the manipulation. So the angle that is formed in between the right and left hand is called manipulation angle. And if we divide this manipulation angle that is formed by right and left hand instrument into half, that is called azimuth angle, which is formed between the working instrument and the optical port. And if you can see this third angle that is made between the working instrument and the horizontal plane, this is called elevation angle. Now, why these angles are important? If we work within the ideal angles, the efficiency of performing any task will be increased. So manipulation angle ideally should be 60-degree. That is the angle between the right and left working instruments. And if we divide it by 2, then it will be azimuth angle and that should be 30-degree. And the elevation angle or elevation angle, that is the angle between the working instrument and the horizontal plane, that should be also 60-degree. In this diagram, you can see the manipulation angle. Like in the hypogastric region, there is a target which is shown in the black dot. On this side, this is the right working instrument. On this side, this is the left. In center, this is the optical port. So this total angle between the right and left instrument is manipulation angle. And in this picture, you can also see the same. This is the azimuth angle, which is between the optical port and working port. And this horizontal angle is the elevation angle, which is between the instrument and the horizontal plane. This is again the picture of azimuth angle, and the ideal azimuth angle is 30-degree. Now, surgeon posture is also very important. As I said in the start, that this is the posture of the surgeon that leads to early fatigability, muscle spasms, shoulder pain, neck pain, and many other problems. So better posture for a surgeon during laparoscopic is more important than the open surgery. So as soon as the table moves up, the hands and arms are moving away from the body, and that increases stress on the deltoid and trapezius. So what to do in that case? We need to use platform for that case. If the surgeon height is low and the table is comparatively high, or the patient is very obese or big in size, then you can adjust your height by using a platform. This is also very important when we are busy in laparoscopic surgery. we are unaware of ourselves because we are concentrating on our target organ and achieving certain tasks. So it should be avoided that prolonged weight on single leg causes asymmetric weight bearing, particularly in those cases in which we are using quadrupedal. Like in this picture, the surgeon is using left foot for the quadrupedal and his total weight is shifted towards the right leg. And this is the thing which can lead to prolonged prolonged standing on prolonged asymmetric weight that is transferred to one leg can lead to early degenerative changes in the knee joint. Similarly, the neck posture. In this diagram, you can see that when surgeon is standing erect in position, a 12 pound of weight of head can be increased to the 42 pounds of weight of head and neck if the surgeon is tilting his head forward for at least 30 degrees. So only with 30-degree forward tilt of surgeon's neck, the weight of the head increases to 42 pounds from 12 pounds. And that causes mid-cervical degenerative changes in the neck of the surgeon. And it can also affect C3, C4 nerve roots, which are supplying the shoulder girdle and the upper hand muscles, affecting the surgeon's capability to perform. Similarly, reflex posturing while concentrating on a screen should be avoided. Arms should not be totally adducted and there should be no internal rotation of the arms because it increases stress on the deltoid and trapezius muscles. Apart from surgeon posture, the patient position is also very, very important. For example, if you are performing laparoscopic hysterectomy and you are putting the patient in lithotomy position, so the lithotomy position can occupy space from you on one side. So the bend lithotomy rods should be bent at an angle and keep the knees padded and supported. And the leg or thigh which is toward the surgeon, that should be slightly away from the surgeon so that you have enough space. Now there are certain recent advances which can help in decreasing the stress, physical stress and psychological stress on a laparoscopic surgeon, and that is increasing with the advanced cutting technology with day by day. Like in monocular vision, when we see at screen, that is 2D picture in which we cannot see the depth perception of a picture. And if one person close one eye and do visualization with a single eye, that is also like a 2D picture. But if a person is looking at something with the two eyes, then it also gives depth perception, and that is called 3D picture. That's why binocular visions, which is used nowadays in advanced and latest robotic consoles, gives you 3D picture in which you can perceive for the depth as well. Similarly, the robotic arms also increases the dexterity. There are wrist-like movements within the abdominal cavity which are not present in the simple laparoscopic instruments, and these also increases efficiency of surgery, decreases the stress and strain on the surgeon who is operating on the robot. Similarly, other advanced endo wrist needle holders are also present in advanced countries in which the needle holders are having an angle that can work like a wrist within the abdominal cavity, and it makes the suturing, endo suturing quite easy. So 3D laparoscopic instruments and robotic surgery are increasing the efficiency of the laparoscopic or robotic surgeon, and robotic surgery is ergonomically better than the simple laparoscopic surgery, and better wrist-like actions are present in robotic facilities, and there is increased degrees of freedom. And another benefit in robotic surgery is that seated posture causes less mental and physical stress. So the basic problems is the lack of the complete awareness among the surgeons, because there is the data that only 11% of surgeons are aware of the ergonomics. There is also communication gap between the practitioners of the laparoscopy and designers of the instruments. Inadequate knowledge of the potential problems for the users in instrument created by the designers, and the contradictory expert advice which reduces the credibility of ergonomics is a science. So what is the take-home message? Laparoscopic surgery provides patients with less painful surgery but is more demanding for the laparoscopic surgeons. The increased technological complexity and sometimes poorly adopted equipment have led to increased complaints of surgeon fatigue and discomfort during the laparoscopic surgery. Better ergonomics integration and understanding ergonomics can not only make the life of the surgeon comfortable in the operating room, but also reduce physical strains on the surgeon, along with the increasing productivity and inoperability. So if you are working smart and avoid fatigue, then we will be able to spend productive and less fatigable life. Thank you very much.
Dr. Imran, an excellent presentation, really. So please stop sharing.
Okay, sir. Stop sharing.
So Professor Zareen is also with us. Professor Zareen, any comment, please? Just stop sharing, Imran.
Yes, sir.
Sharing. Still we can see you. Okay. Professor Zareen, please. Zareen bhai, please unmute yourself. Professor Zareen, can you hear me? I think he must unmute.
Hello, sir.
Assalamu alaikum, Zareen bhai, kaisa hai?
Assalamu alaikum. Ram bhai, how are you?
Please, any comments regarding, because this is the most important topic, especially for our youngsters, because ergonomics is the base of laparoscopic surgery, and without ergonomics, definite, as Imran mentioned, so you cannot do such a long surgeries and long time, you cannot stand. Please, sir.
Thank you so much, Imran bhai. It was an excellent talk by Dr. Imran, and he mentioned so many important points for people who are just beginning with basic laparoscopy, and even for people who are already doing or who are intending to do advanced laparoscopy. And I think without ergonomics, minimal access surgery is next to impossible. So this is the most important and crucial part, and people who are observing the basic principles of ergonomics, they learn, and the learning curve becomes so much easier and so much shorter for them.
Yeah, so my thanks. So any question from our fellows? Any question? Dr. Zara, please, any question? You are from Lahore, I think. Please unmute yourself. Dr. Zara, can you hear me? Please.
So it was a good presentation and I learned a very good thing. So I want to ask a question: if robotics are now in, then what's the role of learning, how we can learn through the patient, and how the youngsters can learn, and what's the role of hands-on operative in the coming future?
This is Dr. Zara, good question, because we must go on endo trainer. We must train on endo trainer. You must do practice on endo trainer. Definite you have there. Professor Mohsen Gilani, I remember he has such a facility there, and you must do, and you must, how you do this, how you do your intracorporeal suturing, your standing position, your arm position. So these are all the points, and then practically you can see and you will be witness on your patients. But yes, the main practice, especially for our youngsters, on endo trainer is more effective.
Sir, may I comment to the question of Dr. Zara?
Please.
Sir, one thing is that I want to show, as you mentioned, this is my endo trainer, and this is one of the most important thing, as you mentioned. Another thing is that for learning robotic surgery, recently I have studied an article in which it was concluded that if a trained laparoscopic surgeons are having shorter learning curve for learning robotic surgery as compared to the open surgeon. So as you said, first endo trainer and then laparoscopic surgery, and then it's easy for a laparoscopic surgeon to do the robotic surgery.
Dr. Sangeet, have you any question? TG, sir, please. Professor Zari.
Professor Imran, you rightly mentioned that the role of a box trainer is very much important, and it's one of the vital thing in learning laparoscopy. And every unit and every specialty having an MIS should have a mini lab for these box trainers. Okay, obviously there are certain limitations in the part of the box trainer that ergonomics are not that much good and box trainers as compared to like humans. But once you are trained on box trainers and then you come to real OR, so there's much difference between those who are trained in box trainers and those who are just new in real ORs.
I agree, sir, because this is because when you are going to start MIS or laparoscopic surgery, so this hand-eye coordination is very important. That is also a base, and definite ergonomics. So ergonomics, hand-eye coordination, these are the combination, and your practice must be on endo trainer, how you hold your tissue, and this your smooth hand, because we all are open surgeon, and our so we are harsh, little harsh. But when you will hold this cresper needle holder, how you hold the tissue, because your tactile is less, how much traction, but your self position. So these all are the points, important points, and your training and your practice must be some part of your practice must be on endo trainer. Then it will be more effective.
Imran, my question to hello.
Sir.
My question to Dr. Imrannudin, that you mentioned about that the monitor should be placed at a distance at a point where it should be a 10 to 20 degree down the eye level. So it's a question to all of us whether we observe this this important point in our real ORs or not, because majority of the times the monitors are quite above the head level and they are quite tiring ones.
This is a great point. Imran, please.
Sir, this is a very important question, and this is that's why, sir, it is said in earlier in the lecture that there are only 11% of laparoscopic surgeons who are aware of the ergonomics. So if we see at the design of the trolley, there are multiple chambers in that, so they can be also adjusted. If one can adjust the screen in the middle chamber as well, if you want to adjust it, and similarly it can be set at the top of the trolley as well. So it is designed for the purpose, but these are we surgeons which are lacking in awareness, and I think we should be realizing it, because it is very important for proper neck and back of the shoulder posture.
Yeah, this is the important point, and as mentioned Imran, so because if we will go for a standard OT or standard operation theater, we must have 3 monitors, and they must be fixed with the ceiling, and then you can mobilize your monitors and also adjust your monitors. This is the standard, but unfortunately our OTs are not standard operation theater for MIS advanced, especially a MIS program, but we need such a standard OTs. We must have 3 at least monitors, then your assistant can easily see, so no need to turn the neck. And also your both assistant, they have access and your access as well. It depends on your position. If you are standing your French position, you're at right side of the patient, left side of the patient, your monitor is especially in front of you. These are the points, and definitely we need, and we will go ahead for such a facilities. Any question from our fellows? Dr. Sangeen, have you any question? Sangeen, I can see you. Please unmute yourself. Dr. Sangeen, can you hear me? You must unmute yourself.
Hello, sir.
Hello.
Hello, sir. Assalamu alaikum.
Walaikum assalam.
So much from Sir Imran, and it was a good conference. And I have one question, sir. And dear share must be attention about the co-axis alignment or angle. If we do a mistake in dear and we take the port in incorrect area, can we change it or not?
So this is a good question. Yes, because patient safety is more important for us. So there is no, yes, first of all, try your best. So to do first try, so standard. But sometime if you see you are struggling and your trocar site is not the standard site, you must change. So don't think about this, it will be 3 or 4 or 5 trocars. Because if you will be not at your trocar position will be not standard, there is more chance of injury to the patient, and so it will be more harmful for the patient. So never compromise this. There still, if need to open the patient. So there is not ego. So patient safety is more important. And when you will be at a standard position, your ergonomics is standard, your trocar site is standard, then you can do your surgery smoothly and result will be much better than if you will be, so your ergonomics is not standard, your trocar site is not standard, definitely, then you will face more problem. And Dr. Iram, have you any question? Dr. Iram Bashir?
Yes, sir. Dr. Bilawal here.
I'm here.
Walaikum assalam. Please, Dr. Iram.
Yes, sir.
Please, any question?
No, sir. It's very good, informative lecture. Me and Dr. Rana Sangeen were studying from the evening about the ergonomics, and we had very good hands-on on the endo trainer here in the REH as well.
Good news, and definitely you must do your best. In my opinion, this
Yes,
is
sir.
a great opportunity. This is only 3 months. This is not
Yes, sir.
such a period, but in this period you can shine your skills. Already you are doing laparoscopy, but you can shine your skills. And when you will do your practice or training on endo trainer, then you will see the result at your patients. How much it is easy, how much your hand is smooth, how you can rotate easily. So this you will be witness in your improvement when you will practice on your endo trainer.
Yes, sir, sure, sir. हमें 1-2 घंटे में भी काफी अच्छा आइडिया हो गया था कि we are improving every other minute.
Of course, like this.
Yes, sir. Yes, yes.
हाँ जी, Bilawal.
Sir, Dr. Bilawal here.
जी, please.
Thank you very much, sir. Sir, I really appreciate your efforts for minimally invasive surgery, and Dr. Imran has presented very good lecture, and it was very knowledgeable and very presentable. Sir, as most of the beginners in the laparoscopy, they basically discourage only because of the back pain, the hand-finger joint pain, tenosynovitis, burning eyes, stress exhaustions, and the hand muscle injuries initially. So it is only because it is not the fault of laparoscopy, but basically it is the bad ergonomics that they do not know about the basics. That Dr. Imran mentioned that only 11% of surgeons know about the ergonomics. Because better ergonomic integration and understanding the ergonomics can only make the life of surgeon comfortable in the operating room, but also reduce the physical strains on the surgeon, along with increased productivity intraoperatively. So this was my short message, sir. Thank you very much, sir, for your lectures. We really enjoyed it, sir.
Dr. Bilawal, first of all, congrats and you proud of you because Dr. Bilawal also hunt the scholarship, IFSO scholarship for
Thank you very much, sir.
yeah, Australia. Really
That
proud
is
of you.
only because of your guidance, Dr. Zareen guidance, and thanks to GLR, that basically give the exposure, and because we were unaware of this, if so, and all about only these GLR minimal fellowships, these basically helped us in about knowing these scholarships and observerships.
Dr. Bilawal, this is the combined struggle and also PSMBS as well, because PSMBS is like a big umbrella. We all are part of PSMBS as well. If so, Pakistan, GLR has a little contribution for sharing knowledge. This is just like a different colors, flowers, and we are trying our best sharing knowledge. My best wishes for you, and you deserve this position, and especially KP chapter, because
Thank
Dr.
you.
Zia already, I think you 2% from Pakistan and both from KP chapter, and this is a pride moment, and you are lucky you have a mentor like Professor Zareen, and really I'm proud of him many times in different meetings, international meetings I have mentioned. So Zareen is doing his best. Your Sawat chapter, Abbas, Farooq, they are doing their best really, and many others. Maybe I don't know their names, but this is your time. So your time, and enjoy this scholarship, and we will see you at the top of this leadership program, and in near future you will be leader of Young If So. Already I have talked with Aaron Tashkin and also Kerman Saravi, because they are leading person in Young If So. So this is our right, and yourself and also Zia, you must be the part of Young If So, and also lead Young If So at the globe.
Thank you very much, sir. Thank you so much, sir.
So any question from our young fellows? So much thanks. So this was, we will continue our academic activities, and next week, Saturday, then I will announce the time. So which time, because already I collaborate and I in touch with the speaker, then I will announce the time, but we will continue our academic activity. And next Saturday, we will be with Dr. Zain Bashir. He's also GLR fellow. And this is really amazing, great honor. And in my opinion, in next session, next batch, our fellows will be a speaker of such an academic activity. So much thanks, and have a nice weekend.
Thank you so much, sir. Thank you.
Thank you, Dr.
Thank you so much, sir. Thank you so much.
Thank you.